Dr. Russ here. Today we've got Meghan, and we're going to work with Meghan, who we've been seeing for a while, I guess since before either of us turned 40. And we typically work on upper chest, rib tightness, shoulders feeling congested and tight. Sometimes we do jaw stuff, neck stuff. We usually do some cranial work, and the right hip tends to hold a lot of tension as well. And then of course the middle back. I say of course because, not that it's obvious, but because I think that's Meghan's favorite part, is when we do that part. So
that's true.
Yeah, she came in today and said primarily feeling tension here across the sternum, which I feel definitely, right there. So that has a lot to do with ribs, pectoral muscles, and the fascia, the sternalis fascia that overlies the sternum. So we're going to check in with all of that, but first just kind of gently getting things moving and saying hello to the tissues and checking in with the cranium and the occiput and the jaw. Good. So I'm noticing here, upper left, something is a little stuck right there as well. And that shoulder feels okay. And that shoulder feels okay. So I think we're looking more at ribs and sternum. And I think about this sternocleidomastoid, especially for her on this left side, that connects to the sternum here and comes right up and inserts on the left upper cervical here. And I think that's probably what's causing her left occiput and upper cervical to feel a little jammed up. So we're going to start here. Now, how do we address these upper ribs? We start under the clavicle, so we can see her collarbone coming through the gown right there. And right here, I'm going to get my fingers underneath it a little bit, and I want you to breathe up into my hands. Good. And as she breathes, I'm providing some counter pressure. So we're going to start getting movement and stretch in between the ribs, one at a time. So we start above the first rib, between the first rib and the clavicle, and we're going to work our way down. And on her out breath, I'm giving it a bit of a push downward. On women, we have to definitely be careful of breast tissue. We don't want to press on it because it's tender. So we have to come medial and be right up against the sternum, as I'm doing with my fingers here. So on the upper ribs, I can be farther lateral, but as I come anywhere past the second rib, I've got to be very mindful of the breast tissue. Now just one hand, and I kind of push that sternum into my hand. Nice. She's really giving me a good push, and then she breathes out. I'm giving it a good downward stretch. Good. One more time. Good. And with my right hand, I'm getting a little more pressure on the right side of her sternum, keeping my fingers up like that, and my thumb as well. We're going to switch hands so I can stretch her left side coming down this section here. Good. As body workers, anytime we're in an area that's sensitive or off limits, we have to be most careful of what our thumbs are doing, because thumbs sometimes have minds of their own. And breathe on out. That's really good. Breath in. Yeah. Great. Good. A couple more nice deep breaths. Really nice. Good. And we got some good movement there. And we don't often do this, Meghan, but I think you need an adjustment here today. Is that okay?
Yeah.
Yep. Okay. So, good. Okay, good. Easy. Nice. Okay, so that brings us up to the temporalis muscle, which we're working on all the time, connecting the jaw over the ear around to the base of the skull and the occiput. Such an important muscle. It's like a, what's the word I'm thinking of? connector between the neck and the jaw. So, good. Keep breathing. Good. Nice. Okay, let's do some rib work, okay? So why don't you lay on your side face the door first. So we love working with people side posture. Anytime you need to move your legs or your arm, just go right ahead. But it just gives us access to the whole rib cage, the whole serratus anterior, and the front of the scapula right there. Good. My pressure is pretty moderate, not that much, and not pokey. Just pretty gentle. Good. So we can feel some tenderness here. And here's the bottom of her scapula right here. So we're definitely on the serratus anterior. And the bottom of the scapula is even with about the 7th or 8th rib. So I would say this is rib 5 or 6 that I'm on with my right hand. And just gently mobilizing that tissue. A couple deep breaths, Megan, right into my hand. Good. So she's pushing her ribs up into my hand toward the ceiling. I'm letting that go, giving a little tiny bit of resistance for her to push against. And then as she breathes out, I give it a little push just to help expel that air. Nice. Good. Giving traction to the whole side now. Getting a little bit of an anchor on that iliac crest. And I can just use my hands to stretch that whole thoracolumbar fascia. It's moving really nicely. And that keys me in on some tension here in the rotator cuff, the infraspinatus and teres minor right there. So let's get this arm in front of you. And let's just work gently on these external rotators of the scapula, of the humerus rather. So working from the humerus, distal to proximal toward the spine, and gently, yeah, she's always very responsive, and her body always gives really good feedback when you're in the right place. You just know. Yep. She even will sometimes shift to get my finger right on the spot. I always appreciate that. It makes my job a lot easier, and not everybody does that. So if you're watching this video and you're my patient or you're someone else, body worker's patient, it's really helpful for us to get feedback and to feel your body moving and responding. You should always feel free to move and shift and say stuff on the table. You do not have to be passively receiving. Okay, let's work the other side. So on her other side now, same deal. Maybe a little bit of a different order. We're going to approach things because I'm feeling, here's her right hip, that is, as I was mentioning before, often kind of drawn up and needs a little guidance, a little help to release down. So we can see her quadratus lumborum here is a little bit bunchy, and that's going to be pulling on the rib cage. But we're not going to get into that too much just yet. Just kind of saying hello. Let's feel what the ribs are doing. Feeling good. Deep breath right into my hand here till we get up to about here. So I'm actually in front of the shoulder blade, in front of the scapula now, between the subscapularis and the serratus anterior. That's where she's holding today. Nice. So I would love for you to, get your breath right up into there, where my hand is. And I'm going to take your arm. I want you to keep it as relaxed as you can for me. And now with my hand, my left hand, I'm giving movement to the shoulder. And with my right hand, I'm encouraging that movement to induce mobility between the shoulder blade and the ribs. So it's not all just taken up by the ball and socket. but the scapula is moving as well. Good. Good. I can breathe right into my hand and let it out. Good job. And that brings us to the hip. Can you straighten your top leg, Megan? Thanks. So that gives a little bit of weight, right, and tractions that top part of her pelvis down. I'm going to lighten up a little bit here, but this is where we need to be. Not totally sure yet what this needs other than some traction. So we're just going to work with some traction. Good, and she's helping. This is very, very helpful. Thank you. Was that your ankle?
Mm-hmm.
Good. Nice little freebie adjustment on the ankle. Okay, here we go. So here's L4. Right here, this is where it's pretty stuck. Okay. Yeah. Yep. Okay, I'm going to shift position here. Can I have your leg?
Mm-hmm.
Good. So keep it nice and relaxed. So you can see I can use her leg as a lever and get some movement through the lumbar spine this way. Right? As her knee goes toward the table, it internally rotates her hip, and that rotates her lumbar spine as well. We want that. We want those things to be moving together, and we want to have all the mobility in there. And we're going to do the opposite as well. As I lift the knee, it externally rotates her hip, and we get some opposite rotation into the lumbar spine. Just like that. Nice deep breath. Good. There's no need for dramatic twisting and popping. So we can adjust that vertebra just like that, just by mobilizing it. It wants to be in alignment with its neighbor. It just needs the opportunity. Takes a little bit longer than the lie on your side pretzel twist, but it's a lot safer and longer lasting. So we're checking in with her hip flexors here. Feels pretty good, actually. A lot less tense than normal, or I should say than usual for you, till we get right about here. Okay, so what I felt on her hip was, a lot of times we feel iliacus and psoas really tight on her, but today it's more here. So I'm on her rectus femoris, which is a hip flexor as well as a quadricep. And it's pretty bunchy right here mid-belly. There's often this part of the muscle harbors a trigger point that will either send pain, a dull ache right into the knee, or tension up into the hip. Sometimes both. There we go. So this is one of those times where it feels like the tension is more in the fascia between the muscle and the skin than in the muscle itself. So that's where my hands are being drawn. So right there. Right there. Good. Okay. So I'm working across fiber, and now I'm working longitudinally toward the heart in the direction of the lymphatic flow. And as always, we don't want to overwork it. We don't need it to completely and totally let go under our thumbs. What we need to do is get some proprioceptive stimulation in there with the deep pressure. We need to flush out the congested lymph and venous blood. And we need to make room for fresh circulation to get in here, because it's the circulation that relaxes and soothes the irritated tissue. So the point of the whole thing is to increase blood flow, mobility, and circulation. That's really what we're after. So following that rectus femoris with pretty firm pressure all the way down to its attachment. Let's cross the knee. Careful of the kneecap. There's trauma in this lower leg for sure. Yep, we don't need to handle it too rough. We can see a scar right here. And so you can see really nicely the definition and the insertion of her patellar tendon right here. People sometimes think of the patellar tendon as just being this piece. That's the thickest part of it, but it's this whole thing. It really surrounds the kneecap, comes in. This is a very broad insertion, like this. So it's not just that. It's all of this. Good. Okay. Now with her face down, we can really assess her thoracic spine. For the pattern often that comes up for Meghan is kind of a compressive between here and here. And it's present today. Not too bad. It's definitely been tighter. So what we're going to do is work from the skin level in. We will mobilize the thoracolumbar fascia and the paraspinal muscles underneath it. Then we'll mobilize the vertebrae themselves. We have a couple different approaches we use with Meghan, and we'll see which one she responds to today. Bodies sometimes are very particular about how they want to be moved, and sometimes not. So we'll see. I'm still pretty much at the fascial level, not working the muscle yet. It's pretty smooth. Meghan and I work together about, I'd say, once a month. So I would have to say she is well cared for, and her tissues accumulate some tension, but not too much. And we can see that bit of tightness in this section right here. Thoracic erector spinae. We could call that longissimus thoracis if we wanted to speak Greek. Left side, not as much tension. So coming right here, there's T7 right there. And I'm going to come up and out and follow, get perpendicular to this muscle. You can see the muscle fibers running obliquely downward. We're going to work perpendicular. You can, because of her definition, you can see the stretch happening. Trying to get my fingers, I know I can't really get them under the muscle, but I'm thinking about, like, can I get my finger under the muscle, my pinky, and really lift it and move it and get some space between the muscle and the spine, between the muscle and the ribs. Because we need that space for movement and for circulation. So, okay, and we're keying in on some more focal tension here around the right scapula right there. Sometimes it's nice to, if the patient's shoulder can handle just a big old hang like that. Is that okay? That gets her scapula up and out of the way a little bit. I can get deep into that. There again, going perpendicular to the muscle. That's her lower trapezius right there. Okay. Good. So I've got her calf muscle here, gastrocnemius and soleus, and I'm going to be anterior to the soleus on the tibialis posterior attachment, the upper part of the posterior fibula right here. Always very tender on folks. Don't want to be too aggressive here, but you okay, Meghan? Mm-hmm. Good. She's like, yep, we're good. Okay. Yeah. This is the leg that has metal in it?
Yes.
Yes, so
Ankle.
Ankle, okay. Yeah, down here there's some surgical fixation with steel. So remembering that helps me handle the ankle and also tells me how much movement in this fibula is going to be normal. Because to some extent, it's stuck forever. Yep. Yep. Okay, let's do this part.
Okay.
Okay? Okay, so we're going to mobilize her middle thoracic spine over my knee. Okay, so the towel's here because I got oil on her skin, and my knee goes right behind her sacrum. Lean back against me. Take a deep breath in. Let it out. I got you. Good. Good. Come on up. That felt right. Yep. Got it right here.
3 or 4.
Yep. Okay. Thanks, Megan. Great to see you.
Thank you.